And now weather with our anchorwoman Veronica.
As you can tell, it's a chilling 32 degrees outside right now, but it looks like our weekend will warm up to about high 60s, and next week is looking like snow, so everyone get ready to bundle up and stay warm.
Wedding video.
And now back to the studio for more Channel 5 news.
Thanks, Veronica. What a wonderful weather we have. On to sports. The NLCS is coming up. Before we get to that, though, we have one item of business: thyroid disease. The local community has had an outbreak. Thyroid disease first. It is a bow tie like structure located near the trachea. My colleague here will show you a diagram of where it is. If you can notice there, the bow tie is the thyroid, located near the trachea in the throat. Thank you, Rob.
Anytime, Bob.
The thyroid releases several hormones, two of which, one, it helps the oxygen get taken into the cells, and the second helps metabolism in the body. The thyroid cells are the only cells in the body which can absorb iodine. There are many other functions and structures, things which the thyroid does, which causes some of the problems that we have been seeing here in our local community. First of all, we want to advise everyone to be very careful. Do not take in too much soy. These are ways to prevent thyroid disease. Be careful of feeding infants soy as well. Be careful of fluoride in water. It can lead to thyroid disease and can trigger some of the worst thyroid problems. Iodine, like we mentioned, getting too much is a very big problem. You need to take that in moderation. If you are smoking, I would advise you to quit. And also to reduce your stress. Stress can cause thyroid disease. There are many thyroid diseases which we want to talk about. First is hypothyroidism. Second, autoimmunity thyroid disease. There's also goiters, thyroid cancer, and many others that we may not mention. These are just a few of the thyroid diseases that we have. Veronica now, my co-anchor, will help us talk about some of the causes and symptoms. Veronica?
Okay, some problems that come from thyroid disease is overexposure to radiation. Also, if you get an overconsumption of soy products, like Bob mentioned.
Guess I have to stop drinking soy milk then.
Yes, I guess so.
Not so good for you. Also, if you've had any radiation treatment for cancer that was in your head, neck, or chest, that's another risk factor for thyroid disease. Also, it says to not eat too many uncooked foods such as Brussels sprouts, broccoli, turnips, radishes, cauliflower, and cabbage.
Didn't like broccoli much anyways.
You can eat it cooked. Anyways, on to different risk factors. Of course, women are more at risk for thyroid disease than men, 8 times more to be exact. It can be genetic, so if anyone in your family has had thyroid disease, you want to be checked because it can run through your genes. Also, the age where you're most likely to have thyroid disease is between 20 and 40, and during pregnancy and the first year after pregnancy. As Bob said, you don't want to smoke. That is a risk factor for thyroid disease. Some symptoms you might have if you have thyroid disease are weight gain, constipation, low body temperature, fatigue, feeling run down, sluggish, or lethargic. If your hair is coarse and dry and brittle and breaks easily, dry skin, feeling depressed, feeling restless, moodiness, and a difficulty concentrating. You also will be more likely to forget things.
Very interesting.
Very interesting. I think we should take it over to Ron and see what he has to say.
Loss of memory not good for those college students.
Not very good.
Maybe it has an effect on the hippocampus.
Possibly.
Well, let's go over some treatments. Thyroid disease can be very scary. If you feel yours, you might think that you have it, but maybe you don't. So let's go over some treatments just in case you do. Alright. The other thing, before we get into treatments, the other thing I found so amazing was how many different things come. We get goiters from thyroid disease.
Very true.
Graves' disorder from thyroid disease, and many other things like thyroid nodules, that also can come from thyroid disease. So let's talk about treatments of each of those. First off, we'll start off with hypothyroidism. It can be serious, sometimes very in an emergency status of serious. So treatments are safe and easy. You can take medication that, since hypo is a lack of hormone produced, it simulates the hormone that is produced by the thyroid. And it is levothyroxine sodium. And that can help trigger that so it just becomes natural, and that will help symptoms go away upon use. Now, as we talked about, there are two forms. The Hashimoto, which is an autoimmune where your body attacks the thyroid itself, and then the other one where the pituitary doesn't release enough hormone for the thyroid. So we have to be thinking about those two when it comes to hypo. Now let's go on to hyper. Hyper can be treated with a couple of ways. Surgery, where you either remove or destroy the thyroid itself. Medicine, like as in methimazole and propylthiouracil, can also help to slow down that hyper release of the thyroid hormone. And there's also radioactive iodine, which will lower that amount. And just to note, Graves' disease is a form of hyperthyroidism, or is connected with it. Now, on to goiters. How to prevent those. Reasons to treat them, there's a couple of those. Sometimes they're not too attractive to have a big lump on the side of your neck, so for social reasons you might get it removed.
Wow.
Others, they grow at a rapid pace. So one day you might start with a little M&M bump, and the next day wake up with a grapefruit. And obviously that would lead to blockage of your airway with a hard time breathing, or a hoarse voice, which not too many people enjoy. It can push on that voice box, which isn't too bad, and you would have to have a thyroidectomy, which is just a removal of the thyroid, and that could help get rid of that goiter. Alright, last one we're going to talk about is those thyroid nodules, just lumps on your thyroid. Treatment is the same as all. Pills, medication, therapy, or even time can get rid of thyroid nodules. And most of them, so you don't worry about it, are non-cancerous. So you still want to get them checked out, but don't worry too much when you first get them. Now those treatments are critical because the effect that a thyroid disease can have on your life is it can mess up your vision, so you don't have 20/13 in one eye, or even 20/25 in the other eye. That's what I have.
Nice.
Like I said before, it can cause anxiety. We already have enough of that in our lives. It can mess up with your breathing, as in having a goiter, or it can also mess up your metabolism, so it'll change your weight and mood. Not good for women.
No.
Other things is if you fix your thyroid disease, it can re-regulate your sleep so that you're well rested, and also give you more energy to get through the day, because we only have a few days of sunshine left, so we're going to need all the energy in the next week, month, to get things done.
I know, as we saw in that weather report.
Oof.
So pretty much of an overview of this thyroid disease. We have hyper and hypo, correct?
Correct.
So hyper is when it's overactive, and hypo is an underactive thyroid, and then the goiters and such come as part of that.
Yes.
Correct?
Correct.
Fascinating story. Now on to the ALCS.
On to the ALCS, NLCS. Those games are coming right up next after these short break.
I was like, for a second. Make sure you don't.
I don't know if you can see this, but there's steam coming out of about